A common type of anaesthetic we use here at Moorfields is the subtenons block. This is a local anaesthetic, which means that you'll be awake during your surgery. It's a very safe and effective way to numb the eye for your operation. If you're very anxious, we may use a sedative drug. This is an agent we give as an injection through a drip in your hand, which helps you to relax, but you will remain awake and cooperative during the operation.
When it is time for your surgery, a nurse will escort you from the ward to the anaesthetic room, which is next to the operating theatre. This is where you will receive your anaesthetic before going through for your operation.
My name's Belinda, I'm an ODP.
Here, an anaesthetic assistant will introduce themselves and check your details again.
Okay, so patient's name and details the same. Patient's sign for the right eye, and it's also been confirmed.
The assistant will help you lie on your back on the theatre bed and attach some monitors to measure your heart rate and oxygen levels.
And last but not least, the little blood pressure cuff goes on your arm.
That's at 97.
You will first be given some eye drops to numb the surface of your eye. For a subtenons, a local anaesthetic, the anaesthetist will clean the area around your eye with a cleaning solution such as iodine. A small clip will then be placed under your eyelids to keep your eye open and stop you blinking.
Both your eyes, that's it. Look at me, look at my hands.
A small amount of local anaesthetic liquid is inserted in the corner of the eye just underneath the surface. You may feel pressure sensation or a mild stinging for a few seconds. The whole process takes a few minutes.
Good, well done.
Once the anaesthetic has been given, you will be moved into the operating theatre on your bed for the operation. You will be monitored throughout your surgery to ensure that you are safe and comfortable throughout. After your surgery, you will be taken to the recovery room where you will have your heart rate, blood pressure and oxygen level measured by a nurse. The recovery nurse will check that you are comfortable and you are not feeling sick or too drowsy before you go back to the ward. On the ward, you will have your eyes checked and a final set of heart rate, blood pressure and oxygen level tests. You'll be given something to eat and drink. You'll also be given instructions on how to care for your eye at home after surgery and a prescription of eye medicines and painkillers if you need them. You can then go home to make a full recovery from your surgery.